pharmaceutical agents that can be considered for their potential benefits. So just physical stimulation can be effective, according to Grenwald 2019. This study was done and conducted where it showed evidence that some women can have objectively decreased sensitivity to just clitoral vibration while the vaginal sensation remains normal. And so this can be used when considering psychological and physiological factors and essentially highlighting the central role of more than just clitoral stimulation for a female orgasm. Bupropion, which is a typical antidepressant, which has gained attention for possible treatment. It has been used to alleviate low libido and improve orgasmic function, particularly in cases where there is antidepressant induced sexual dysfunction. And according to this study, it was shown to further research on whether this can be applied to women who have just female orgasmic disorder without being on an antidepressant. Cannabis shows promise as a therapeutic agent for women with orgasmic difficulty, and its benefits appear to be highly dose dependent. And so this allows the clinician to show different medical informed uses of cannabis, according to Mulvihill 2016. And then there's aromatherapy, which has shown promising results for treating FOD. Studies have highlighted the effectiveness of using these essential oils in improving sexual function. And there's different compounds in these oils that stimulate different systems in the body, which address sexual dysfunction, as well as the yoga or tantra, which aims at enhancing self-awareness and reducing anxiety, promoting changes in the thought and behavior processes, according to Wenchkin 2024. And so there's a few different goals and techniques that can be essentially provided to clients. And so we want to ensure that everything that we're doing is in the overall improvement to our clients' quality of life. The diversity considerations: each client diagnosed with orgasmic disorder has a unique experience, as detailed before. A clinician must use intersectional framework, accounting for the multitude of identities that each client plays in regards to their race, their age, social economic status, sexual orientation, etc. And once all of these are considered, the benefit is to incorporate their values into treatment. A client must feel truly autonomous over this disorder from a CBT perspective to see the benefits. The ability to recognize discrimination and potential harm or trauma is crucial on the behalf of the clinician. And so a client's experiences with female orgasmic disorder affect their trust, their stress, their confidence, which can influence their sexual functioning and disorder, which is why the CBT Therapeutic Alliance needs to be met with humility and understanding, because a clinician must adapt their interventions to the client's experience. So this isn't a fit-all model, but essentially a framework that is built to each client. There are a few possible adaptations with working with Christian clients. Firstmost is CBT therapy emphasizes agape love. This particular therapy pays attention to unresolved developmental issues. It pays special attention to spiritual aspects of life. We can use biblical truth for reconstructing these negative cognitions. So like, what would God or the scripture have to say about this? And if a client desires Prayer, scripture, reflection, and collaboration with trusted clergy can be integrated into treatment with their consent, according to TAN 2022. Empirical support demonstrating its efficacy. CBT is a short-term structured psychotherapy that targets maladaptive thoughts and behaviors related to sexual function. It is the primary therapy used to treat FOD, as it's well established and has demonstrated benefits in reducing performance anxiety and enhancing orgasmic ability. Often combined with interventions such as directed masturbation, sensation focuses, pelvic floor, muscle therapy. CBT plays a foundational role in comprehensive sexual therapy programs, according to I'm going to say this wrong, Dashiria 2025. It may be beneficial to involve the partner if appropriate. And so, again, directed masturbation exercises, mindfulness based attention to bodily sensations. It is unique to involve both partners in the treatment, where we can address communication difficulties, unrealistic expectations, relationship distress, and responsiveness to that distress. CBT has been shown to be effective in treating FOD by helping women gain and regain the ability to have orgasms, whether the cases have been lifelong or generalized, according to Wenchkin 2024. And so these are all my references. Bottom line for this is FOD is going to be best treated when a clinician understands the client from a full perspective, and CBT is the best form or the more readily available primary use form in treating this disorder.